We first evolved being in an arms race with bacteria and viruses and fungi that infect our bodies. And because of that, our immune systems are very diverse across human populations, and for every infection that I'm aware of that we've studied, there's a very broad range of responses. Some people become desperately sick and some don't even notice that they have it, and that is definitely true for COVID-19. Part of the reason for that lies in the genes, and we hope that by finding those genes we'll be able to understand the disease better and come up with better treatments.
What are the ambitions and timeframes of the research?
The ambition is to find the specific parts of our DNA that are causing people to be susceptible to COVID-19 or changing their chance of living or dying. You need large numbers of people in genetic studies because there's so much variation in the genome that if you compare small numbers of people, you're never really sure that the differences you found are really due to the susceptibility to the disease. We're recruiting people across the whole United Kingdom just now, particularly focusing on both the areas and the ethnic groups that have suffered most at the hands of COVID-19, so particularly in the south of England, and black and minority ethnic groups who have been overrepresented in the cases we've seen in intensive care.
For the study, they've been collecting DNA from people that are critically ill in ICU, as these individuals are the most susceptible to the disease. The target is to collect and analyse 100,000 genomes worldwide.
We also need to find people at the opposite end of the spectrum who are not susceptible to the disease but resistant. And the way to find them is to find people who know that they've had the SARS-CoV-2 virus in their bodies. I mean, a third of the people who've been exposed to the virus. It's a difficult group of people to find because, of course, they haven't had symptoms, so they, in many cases, don't know that they've had it.
You've been working in ICU. What has that experience been like?
It's been unlike anything I've ever experienced. There have been aspects of this that have been harder than any other time in my career in intensive care. I think probably the single hardest thing has been the fact that patients' relatives are not able to visit them because of the lockdown rules and the risks of transmission. So we're unable to have face-to-face personal interactions with people's relatives when they're desperately sick or even dying in some cases. And of course, that's tremendously distressing for the relatives of dying patients. The response to the outbreak from hospital staff and volunteers has been absolutely extraordinary, and it has been quite wonderful to witness how in the UK the National Health Service has responded.
What's your opinion that ethnic minorities are more susceptible?
We do know that within the UK, Black, Asian and minority ethnic groups are overrepresented among patients who are admitted to intensive care. I'm not sure that difference between ethnic groups really demonstrates that there's a genetic reason for it. It could be that the whole of that signal that we see in the UK, the whole of that difference between ethnic groups, is actually because of other illnesses or socioeconomic factors or transmission happening in different patterns in different communities. Human genome has about 3 billion letters in the code of the genome. Between any selected pair of people in the population, there are between 4 and 5 million differences. So the vast majority of all of our genomes are identical to each other. But those 4 or 5 million out of 3 billion differences encode all the differences that there are between different humans.
It sounds like you have to crunch through an incredible amount of data. What will it ultimately tell us?
What that will ultimately tell us is which bits of the DNA sequence are changing the way your body functions in a way that makes you more or less likely to succumb to COVID-19. Ultimately, I think it's likely that there will be many different points on the genome that are associated with susceptibility to COVID-19. But of course, our focus right now is to do anything we can that will help us to come up with better treatments for this disease.